The debate over reforming Maine's child protective system is back in the spotlight at the State House. Good evening and thanks for joining us. I'm Pat Callahan.
And I'm Tori Ryden in for Amanda Hill. State lawmakers joined foster parents and some families to call for change to the system.
This comes as one group of legislators continues working on the issue, while others are defending the changes that have already been made. News Center Maine's Don Carrigan has our top story tonight.
The system is broken. We want to help fix it.
Senator Bill Diamond said it's the first time in 2 decades that lawmakers and advocates have joined in public to call for changes to Maine's child protective system.
And we're asking for an end to a culture that's built on resistance, denial, and excuses. We want to help. We want to make the system better.
They stood behind 178 pairs of shoes, representing the number of children with connections to DHHS who have died since 2007. Diamond said the vast majority died from natural or accidental causes and not from any kind of abuse. 2021 saw the highest yearly number yet, and lawmakers say 4 of those deaths were allegedly victims of homicides.
This is not a partisan question. It is not an issue of who is to blame. This is a life and death issue.
Foster families shared their stories of what they say was DHHS needlessly taking children out of foster homes.
We are a vested foster family with good relationships. Instead, the lives of 13 people in my home were disrupted in an unnecessary and traumatic way.
Another who told of children being sent back to abusive homes.
There are many caseworkers who I know personally who are burnt out from a job where they're forced to send children back into dangerous environments. The result? They resign.
The legislature's Government Oversight Committee continues to ask questions about the entire system, planning to keep meeting all summer and fall to find solutions. We were not able to talk with anyone from DHHS on camera, but the agency did send us a written statement. And it also pointed us to a newspaper op-ed by 2 members of the legislature's Health and Human Services Committee who said the legislature and the department are already taking the right steps. The op-ed by Representatives Michelle Meyer and Michael Brennan criticized some lawmakers for not getting their facts right. And it said the legislature, DHHS, and the governor have a good plan, and that the focus now needs to be on urgent implementation and tracking ongoing progress, not more talk and task forces. For its part, DHHS said it is willing to hear from others, including advocates, child care providers, families, and others devoted to improving the lives of Maine children.
Processes that we've done.
Meanwhile, the Government Oversight Committee did talk with DHHS staff members today and will presumably do more as they continue trying to find answers. In Augusta, Don Carrigan, News Center, Maine.
The legislature did pass several bills and provide added funding in the latest budget. Representative Holly Stover, the co-chair of that legislative committee, says they will continue talking with DHHS staff when they meet next month and says this is a bipartisan effort to find the answers for how to make the system better.